Hi.
It worked.
It worked. Welcome.
Hi.
Hi everybody. This is Laurel at Adyn. Today I'm talking to a very special guest. This is Naomi Fener. Naomi just guest wrote two articles that are currently live on our website, adyn.com. Hi Naomi, welcome. How are you?
How are you?
Good. Just a quick intro about Naomi. Naomi is a nurse practitioner with a master's in public health. She has worked in healthcare for over a decade in intensive care, emergency medicine, transitional care, and most recently in health policy. And my favorite fun fact about Naomi is that she happens to be my oldest friend, a buddy from preschool. So that's fun. Um, Naomi, can you share an example of how you saw health policy directly impact one of your patients?
Yes. So I wrote about this a little bit in the blog. We see it all the time. Even when we don't want to see it, it's kind of just always there in the background. And so this one particular patient, he was a truck driver from kind of the middle of Massachusetts, didn't have a ton of access to healthy food, fresh fruits, fresh vegetables, anything like that. He would drive like 13 to 15 hours a day, so didn't have time for exercise and ate most of his meals while he was working. So he ended up having a massive heart attack, got sent to us for some higher level of care, and spent 5.5 months with us in the ICU on some really intense devices. We were essentially beating his heart for him and keeping his blood flowing for him while he was waiting for a heart transplant. He ended up needing a heart and kidney transplant. And the heart and kidney that he got was from a donor that was Hep C positive, which is a virus that is not great to have and can do a lot of damage to your liver. So we had to give him extra medication on top of his normal medication to make sure he didn't get Hep C from those organs. And that's really expensive. Those are like $100,000 a pill. So on top of his 5.5 month ICU bill and then, some rehab after that, he also had all of those medications to keep him from getting Hep C. So, he walked out of the hospital, he got to see his daughter get married and all of that. And it was absolutely incredible. And it was so great to see him get better. And at the same time, it was really hard to see someone who just needed access to fresh fruits and vegetables and time to exercise. And this all could have been prevented. Like the heart attack didn't need to happen. It wasn't an accident. It was just the result of us not investing in preventive care and public health. So really glad that he did well. I think in healthcare, we really focus on, we'll throw all of this money at the end of life and make sure that people in the ICU get everything they need, but we won't invest in anyone's health.
Yeah, in the things that will set them up to be healthy and potentially avoid
Long term.
these like threatening
Yeah,
situations. Not as you said, that's just one of the many,
many.
many stories of the people that you encounter in the hospital. And it's I think what really stood out to me reading the articles that you wrote for um, that there are just the things that impact our everyday lives are the things that could potentially be really life-saving. And we actually have a lot of control over those things, but if the systems and policies that we live within don't really support those well-known facts, then many people are kind of stuck. So one of the pieces that you wrote about for us was about these social determinants of health, things like where you play, where you live, what you eat, those factors that really came into play for your patient. And then the other one that you wrote about was this concept about civic health. So can you talk about what civic health means? And little spoiler alert, it's about voting, but how does voting connect to a person's personal health?
Yeah, so it's not something that we really learned about in nursing school, we ever really talk about, but voting is very much integrated into our health. A lot of what we are advocating now is that, we know all of these social determinants of health have, like the WHO will quote a statistic of like 30 to 50% of your health is related to social determinants of health. like Laurel was saying, like where you live, where you work, where you play. And all of those things are related to policies that people make, and they're elected by yourself. And so you should, us as providers, should care about whether or not you're registered to vote. We want to make sure that you have a say in who's making those decisions about your body and your life. And so, we don't say who to vote for, but we're really pushing providers to be asking, are you registered to vote? Do you have a plan to vote? Um, and trying to make the connection for folks that, if the zoning is really off in your town, and I think one of the best examples is like redlining, where certain populations were forced to be and could only buy property in certain areas of cities. And we've seen the downstream effects of that lately. And those areas are next to factories where the air quality is really bad, or other, toxic environments. Your health really suffers. So we just advocate for folks to register, check your registration, make sure you vote, make a plan to vote, and then vote, and research the candidates and start thinking about policies, not just like how they're going to hit your wallet, but also how they're going to affect your overall health.
Totally. So last message, just go vote. Research now. You can early vote. You can go vote in person. Look up what's going on in your state, in your city. Make sure you're registered. And I would encourage. Oh yeah, go ahead.
I was gonna say, and bring your kids to vote. I think that's like a cool thing that I've been seeing a lot, especially now I have two nieces, and I'm just like, it's so cool to see them get involved and understand from a young age that this is important. And also, healthcare workers are one of the lowest voting jobs categories in the country. So, like, this isn't just us telling other people to do it. We need to do it ourselves. So, remind your friends to vote, make plans to go vote together, and like pair it with a coffee or a cocktail.
Love that. You don't need to go to dinner. Just go vote. Go to your
Go
voting
vote.
station
Yeah.
or go after.
Yeah.
Well, Nick, thank you so much for doing this with us and for writing. Your wisdom is amazing, and it's always fun to have a chance to talk to you. So go check out Adyn's blog to read more. Naomi wrote about that story with her patient as well as other patient interactions she's had. You can learn more about the social determinants of health, and find more resources about why it's important to vote. All that information is on adyn.com/blog. But really, go vote. That's the most important thing to do right now. Thank
Yeah.
you so much.
You're
Talk to
welcome.
you.
Bye.